like the surrounding cells of the organ where they find themselves. They can even invade other tissues and spread. So you have these cells growing abnormally, stripping the organ of its nutrients and all. And if not checked, can cause complications and even death. I must say that breast cancer is very prevalent in Ghana, and is the commonest cancer amongst women.
Upon all the other cancers, breast cancer is the one
common among women. Early detection through monthly breast self-examination is very, very good, because it helps identify this and then put a stop to it as much as possible. And we also have periodic medical screenings where a healthcare professional can examine a woman or somebody who is at risk of breast cancer, and then also curb the frequency or the risk of coming down with complications as such. Then there is the modality of screening. One of the screening tools is the mammogram, where we use x-rays to detect early stages of this cancer in the breast. For any woman who is above the age of 40, we recommend that in 2 years, every 2 years, you have a mammogram done, so that we can pick up early breast cancer in this case. The treatment modalities differ. There are about 5 different treatment modalities, but it is tailored towards the client's characteristics, also based on the stage of the cancer or the tumor, and also the biological characteristics of the tumor as well. I must say that 2% of all breast cancer cases in Ghana occur in men, so it's not limited to women alone.
But then in the men, it's lower than the women. So now in the month of October, what exactly are people doing to, create more awareness to breast cancer? How are we educating the public on this?
One of the ways is by being on TV programs or shows like this. Others are organizing screening programs in their institutions, whether in the hospital setting or maybe at outdoor events. Churches are being called upon to make their facilities available for screenings. Mosque, same. Marketplaces too. Even corporate institutions. I know certain banks we go to and then organize breast screening for them. And among other things, we are the advocates. Yourself, myself, we can tell people about breast cancer and its effects. As we go out there, we talk about it. We make the common Ghanaian knowledgeable about symptoms, the common symptoms of such breast cancer conditions. And in this way, we lower or limit the risk of coming down with complications.
So far in this month, how well would you say people have, gotten the education they need when it comes to breast cancer awareness?
The information is there, but it is not concrete. There are so many misconceptions. When you even look at people's feeds, their statuses, you find 1 or 2 comments on breast cancer, but the information is not all correct. One common misconception is that sucking the breast reduces the risk of breast cancer. It's not totally true. Breast sucking is different from breastfeeding. Breastfeeding is when you're actually producing the milk and then the infant is benefiting from its nourishment. But breast sucking in itself does not confer any preventive modality when it comes to preventing breast cancer. So the information is there, but it's not all correct, which we must.
Definitely. And we will do that. However, this will be wrapping up the show. But then before that, if you have any last words.
As you rightly introduced me, I'm with Bando Memorial Hospital. As part of civil duties, we are organizing free breast screening for every woman of childbearing age. You can walk into our facility and have your breast screened, and the necessary treatment modalities that would be specific for you as an individual will give to you.
Thank you so much, Dr. Michael, for joining us.